die. D for depressed mood, I for interest, which is lack of interest, and E for reduced energy. And the other common symptoms which are related to the depression are decreased attention and concentration. Sorry, uh, decrease attention, concentration, decrease self-esteem and self-confidence, and ideas of guilt and suicidal ideas. And there are the biological symptoms of depression, which are the disturbed sleep, decreased appetite or disturbed appetite, and the menstrual cycle irregularities in the females. And the according to the symptoms, depression is categorized into mild, moderate, and severe. And there are certain scales to which assess the severity of the depressive disorder. Lifetime risk of the depression is in male is about 8 to 12%, and in female 20 to 26%. Means depression is twice common in the females. And what are the reasons behind this? Actually, it has been thought that females are more vulnerable to stressors and more capable to express their emotions. मीन्स कि ये है कि जब खवातीन पे कोई बात होती है तो वो जल्दी रो पड़ती हैं, और अगर कोई मेल रोता है तो उसे कहा जाता है कि भाई क्यों रो रहे हो, मर्द के बच्चे बनो. ये एक एक्चुअली इट्स ए कॉमन स्टिग्मा रिलेटेड टू आवर सोसाइटी के मेल शुड नॉट एक्सप्रेस देयर इमोशंस. And the rate of depression is twice common in women. The other reason is that there are certain hormonal changes in the females, so females are more vulnerable to depressive disorder. And WHO has stated that in 2030 it's going to be the fourth most common medical illness. Pause, pause. And about 30% of the patients commit suicide. And about 300 million people are suffering from the depression worldwide. At this time, about 300 million people are suffering from the depression worldwide. Pause. Pause. If you look at this slide, mean age of onset is about 27 years, and rates are higher in the unemployed and divorced, and the major depression is much prevalent in the age group of 18 to 44 years. It means it ruins the productive year of a life of a person. And because it's much common in the 18 to 44 years, ये वो एज होती है जिसमें किसी बंदे की लाइफ बनती है या वो फेल्यूर की तरफ जाता है. A study was conducted in Pakistan, and it was concluded that about 44.4% of the population of the Pakistan is suffering from depressive disorder, and about 25.5% were male, and 57.7% were female. Means there was a double ratio of the males as compared to females. Now we come to the prevalence of depressive disorder in various patient population, and it has been seen the persons who are having a stroke or malignant illness or Parkinson disease are more prone to have depressive disorder as compared to the other illnesses, as compared to the general population. So comorbidity with depressive disorder is much prevalent in the persons who are having medical issues. There are certain types of the depression, and major types of depression comprises of mixed anxiety and depressive disorder, in which the person is having mixed symptom of depression and anxiety, although that person is fulfilling the criteria of depression, but the anxiety symptoms are also there. And there is a other category which is called as mass depression, in which the person doesn't present with typical depressive symptom, rather than there are the hidden somatic symptoms such as chronic pain, atypical facial pain, paresthesias, and insomnia. And when you are going to reviews, medical investigations, and different medical tests, nothing is wrong with that person, and that person actually is having depressive disorder. It's more commonly seen in the elderly and in female patients. Other category is the atypical depression. Atypical depression is different from the typical depression. In typical depression, the person is having biological symptoms of depression, such as appetite and sleep issues. But in the atypical depression, person is having different scenario. Although he is fulfilling the criteria of die, but there is increased sleep and increased appetite, यानी कि वो ज़्यादा खाना शुरू कर देते हैं और ज़्यादा जो है सोना शुरू कर देते हैं। और ऐसे ही पेशेंट के लिए घर वाले अमूमन कहते हैं कि काम का न काज का दुश्मन है नाज का, कि सारा दिन खाता रहता है और काम वाम कुछ नहीं करता। And there is extreme fatigue in that case, which is called as the leaden paralysis, and person is unable to do the routine work and all the time sleeping. The other differential diagnosis of the atypical depression may be hypothyroidism. So in this case, you are going to have thyroid function test as well. Now we come to the other category, which is winter depression. It is most common in the West, in which the as winter is approached, the most of the person get depressed. And the treatment of this winter depression is actually light therapy. And there are the centers which are having light therapy arrangements for these patients. Other category is the agitated depression, in which the patient is having agitation, restlessness. The person is unable to sit at a place, and another category is the retarded depression. Retarded, as you know, retardation means slowness. Person is so slow कि उसके लिए जो है ना पानी का एक गिलास लेना भी F-16 चलाने के बराबर होता है। तो person is having psychomotor retardation. And the and there is a very important category, depression with psychotic features. Although the person is fulfilling the criteria of depression, but there are some psychotic symptoms as well. Psychotic symptoms are the delusion of nihilism, in which the person thinks that some part of the body is not working, or there is the paranoia that people are against him, they are going to harm him. Although person is depressed, but these there are the mood related, depressed mood related or mood congruent psychotic phenomena. And when you are going to treat this depression, you are not going to give antidepressant only, but there is the addition of low dose antipsychotic to treat with the depression with the psychotic feature. So these are the different types of the depression, and uh, every type is having its own diagnostic category, and treatment protocols are bit different for every type. This is the verbatim of the patient who came to our OPD. He presented this slip, and you can see the all of the symptoms of the depression and anxiety which I explained earlier. He came to my OPD and he was having this chit, and in which you can see कि तबीयत में घबराहट बहुत ज़्यादा है, दिल एक सेकंड भी खुश नहीं रहता, तबीयत गैर मुतमईन रहती है और तरह तरह की सोचें आती हैं, दिल में अजीबोगरीब किस्म के ख्याल आते हैं, रेवोट्रिल ले रहा हूँ, रात को फिर भी नींद नहीं आती, 2:30 बजे आंख खुल जाती है, मामूली बात का भी बहुत टेंशन होता है. These all symptoms are related to depression, low energy, lack of interest, lack of confidence, और ये सारी चीज़ें जो पहले बताई हैं उसी से ही रिलेटेड है. Now there are the two typical symptoms to screen the depression. If you are going to ask just these two symptoms, you can diagnose the depression very well. Okay. US Preventive Services Task Force recommends these two simple questions from every patient who comes to the psychiatric OPD with the complaints of depression. Uh, One question, which is, over the past 2 weeks, have you felt down, depressed or hopeless? इसको उर्दू में इस तरह से पूछ सकते हैं कि क्या आप पिछले 2 हफ्ते से उदास, मायूस या नाउम्मीद हैं, या ऐसा महसूस कर रहे हैं, उदासी, मायूसी, नाउम्मीदी. The other question is, over the past 2 weeks, have you felt little interest or pleasure in doing things? क्या पिछले 2 हफ्ते से आपकी खुशी, दिलचस्पी या लज़्ज़त में कोई कमी आई है? And if the answer is yes, then you can make the, yeah, or at least you can think about the depressive disorder. And this slide is showing that the systemic consequences of the depressive disorder. Depression not only is going to damage the psychological health of the person, but it also causes the medical issues. As you see in this slide, number one, there is the whenever the stress or depression is there, the hypothalamus stimulates the pituitary gland to release adrenocorticotropic hormone, and this adrenocorticotropic hormone stimulates the um, adrenal glands and causes the release of catecholamines and cortisol. And these adrenal catecholamines and cortisols are l- going to lead to the myocardial ischemia and diminished heart rate variability, and it contributes to the ventricular arrhythmias. An increase in the catecholamines may lead to the platelet activation. This platelet activation causes the atherosclerosis and hypertension. And on number five is the cortisol. Cortisol is going to antagonize the insulin and contributes to the dyslipidemia and type 2 diabetes mellitus obesity. And uh, cortisol also suppress the immune system of the person, so the person is more prone to have infections, or there is delay healing of the wounds. Means if someone is depressed, there is delay wound healing, that person is prone to have myocardial ischemia. And if someone is diabetic, his or her diabetes is going to get worse with the depressive disorder. So these are the medical consequences of the depression. And now we come to the etiology. What are the etiological factors of the depression? Why someone is prone to have depression? So the depression is a multifactorial illness. It's having multifactorial origin. And this multifactorial origin may be categorized into the biopsychosocial model: biological reasons, psychological reasons, and social reasons. Sorry. Now, first we come to the biological reasons. In biological reasons, there is the deficiency of the certain neurotransmitters. On the first comes the serotonin. Whenever there is the deficiency of serotonin, there is the anxiety and depression. The person may suffer from the serotonin deficiency. Serotonin, how you can find serotonin was the reason of the depression. Actually, it has been seen in the depressed patient that they have low plasma tryptophan levels as compared to the normal healthy people, and it has been seen they have decreased quantity of 5 hydroxy indole acetic acid in their CSF. And low level of the 5 hydroxy indole acetic acid is also related to the suicidal ideas, and the persons who committed suicide were also having low level of 5-hydroxyandoleacetic acid. It has been proved by the research. And another neurotransmitter is the low level of the norepinephrine. Actually, epinephrine and norepinephrine are the neurotransmitters which are related to the alertness and confidence and uh, increased activity. But someone having low level of epinephrine or epinephrine, he may have psychomotor retardation and retarded depression. Dopamine deficiency is also related to the depression, and it has been seen the patients who were having decreased hemomanilic acid levels, which is the metabolite of the dopamine, were more prone to have depression. Another neurotransmitter is the gamma aminobutyric acid, GABA. The persons who were deficient in GABA were also having more anxiety and depressive symptoms. And the research has proved there are certain neurotrophic factors, BDNF, brain derived neurotrophic factors, which are related to the neuronal regeneration. But someone who is having deficient brain derived neurotransmitters were having uh, more depressive symptoms. As you see this slide, uh, a patient who was having depressive disorder, but when the BDNF were given from the outside, there was the regeneration of the neurotransmitters. As you see in this slide, there was the regeneration of the neuro. These are the dendritic process of the different neurons. Uh, Monoamine neurotransmitter regulation of the mood and behavior. This slide show is going to show you the effect of the dopamine, noradrenaline, and serotonin on a person's mood. If you consider the dopamine, actually, dopamine is related to the motivation, pleasure, and reward, along with the interest and attention and mood reactivity. Like that, noradrenaline is related to the alertness and energy, and the serotonin is mostly related to the obsession and compulsions, along with the anxiety and depressive state. So this phenomenon is well explained in this slide. If someone is having more deficiency of serotonin, then he is going to have more obsessive and compulsive symptoms along with the mood symptoms. But if someone is having deficiency of dopamine, then he may develop decreased energy, decreased pleasure, and decreased activity. And noradrenaline is also having same effect because it's related to the alertness and energy. Now we come to the psychosocial factors. As I already told that biological symptoms are related to the neurotransmitters, and now we are going to discuss the psychosocial factors as according to the biopsychosocial model. It has been seen early environment of the person is having a great impact on the mm, personality and the future consequences. If someone is having childhood adversity, life events during the childhood, and parental deprivation means that someone's father or mother was died in his or her childhood, that person is more prone to have depressive disorder. Like that, schooling is also having impact on the person's personality and further life issues or to deal with the life issues and such as migration, moving from one place to another place is also considered as having great psychosocial impact. The other factors which are related to the life events. Life events क्या होते हैं? Life events are the events which are having a big impact on the life of the persons, such as death of close family member, loss of job, and divorce, separation, or retirement. These all issues are having a very bad impact on the person's psychological health. You can judge the importance of these life events by the fact that Holmes and Rye developed a scale. ठीक है, जिससे ये है कि उससे आप ये मेजर कर सकते हैं कि किस बंदे को कितना स्ट्रेस है. And they revealed that if someone is divorced or separated, there are the highest number in terms of stress. जैसा कि उन्होंने डाइवोर्स को नंबर दिए 100 में से 95, इस तरीके से सेपरेशन को 90 नंबर दिए. और उसके बाद आता है कि डेथ ऑफ क्लोज फैमिली मेंबर जिसको 85 तकरीबन नंबर दिए गए. तो ये दी और they concluded that कि if someone is having more than 300 score in the consecutive 6 months, that person will definitely have some psychiatric issue. Means कि if someone is having divorce or separation at the same time, uh, there is a death in the family or he is fired from the job and the score is more than 300, then that person will definitely have some psychiatric issue. So every life event is having its impact in the terms of score, such as if someone is having is retired. Retirement is also a life event when the person is having no work and no responsibility. He is sitting at the home all the time. He may feel burden on the family members. He may feel burden himself on the family members, and he may have stress. And the score given to the retirement is about 35 to 40. And in the west they also have a scoring to the death of pet as well. यानी कि अगर उनका कुत्ता बिल्ली भी मर जाए तो उसके भी उन्होंने स्ट्रेस के नंबर रखे हुए हैं. ठीक है. And the other issues related to the depression are the poverty, unemployment, financial and housing difficulties, low educational status, law and order situation. As you see, there are the bomb blast or there are the criminal activities or issues in our culture which are also going to aggravate the depressive disorder. Social injustice, अदालतों में जाएं तो कोई इंसाफ नहीं मिलता, लोगों की उम्रें खत्म हो जाती हैं और फैसले बाद में आते हैं जब वो मर चुके होते हैं. Large number of the children, and the other is the unequal distribution of the roles. You can imagine the importance of this issue. It means if someone is graduate, but on the other hand, he is compelled to work as a waiter in a restaurant because of the unemployment. So that person is actually having the unequal distribution of the roles, and it may lead to the depression. Other issues are the personality issues, personality factors. The persons who are having sensitive, anxious, introvert, or obsessive personality traits are more prone to have depressive disorder. There are certain cognitive theories कि भाई ये बंदा जो है अगर इसकी सोच ऐसे है तो ये ऐसा होगा. Means कि if someone is having pessimistic thinking about all the matters or having the traits of self-criticism, over-analyzing all the time, searching about the negative things inside, that person is more prone to have depression or anxiety. And other are the mind traps. Mind trap thinking is the unrealistic expectations, taking things personally, exaggerating all or nothing. यानी कि हर चीज में एक इंतहा देखते हैं कि अच्छा है तो बहुत अच्छा होना चाहिए और अगर वो जो है बुरा है तो बस बहुत ही बुरा है. दरमियान का उनके अंदर जो है ना, लुकिंग इनटू दी जो है कि ग्रे एरिया इज नॉट देयर. दे ऑलवेज लुक इन into the white and black shades. And the other thing which is mostly related to the depression is overloaded schedule. And you can see this picture. अब जाहिर है एक जानवर से भी आप इस तरीके से काम लेंगे तो उसकी भी टांगे ऊपर हो जाएंगी. Now, what is the management of the depressive disorder? Management of the depressive disorder is also divided into three parts, like biological and psychological and social, biopsychosocial. Before management, barriers to the treatment in our culture are that, okay, if you are going to treat a person with depressive disorder, he may think that he is labeled as a mad, and that person may think, I should be strong enough to control my worries. Why should I seek help? What will people around me think? This is actually the stigma related to the psychiatric treatment. And that person may think that doctor has probably missed a medical cause. They are all the time thinking about getting investigated, and the doctor should find some other medical issue because they are having denial towards the psychiatric psychiatric diagnosis, or they are not going to accept the psychiatric diagnostic entity. And that person may justify himself by saying that, okay, anxiousness is the part of my personality and it is not treatable. These problems are only treated by the sedative drug. It is a common myth related to the psychiatric treatment. Psychotropics are having side effects only and also mask the natural emotions. Person has to take medication lifelong. Once mentally ill, always mentally ill. These are the common misconceptions and myths in our culture, and this stigma is going to aggravate the psychiatric issue. Now we come to the protocols for the management of the depressive disorder. You have to assess to which person you are going to hospitalize and or to which person you are going to give the treatment on outdoor basis. If someone is having risk of suicide and person is in depressive stupor, or he is or she is having depression along with the agitation or panic attacks, and person is not responding to the different medication which he has been taking in the past, and you have to review the diagnosis, so you are going to admit that person. If someone is having risk of suicide on the interview, you should or you must have to admit that person in the hospital. And there are the psychological approaches, biological treatment, ECT, and others. If someone is having mild mild depression, you are not going to give antidepressant. You are not going to prescribe medications. Okay, and recommended treatment is the cognitive therapy, exercise, and sleep hygiene. And if someone is having moderate to severe depression, or if someone is having poor intake and there is threat to his life, or someone is having suicidal ideas, then you have to prescribe antidepressant along with the psychological intervention. And psychological intervention is, there are different types of the psychological intervention in which the CBT is one of the CBT is cognitive behavior therapy. I am not going to in details of these CBT, but there are certain techniques to deal with the depression, in which the one is in which reframing is one of the option. Reframing is a technique to change the way you look at the things in order to feel better about them. Reframing doesn't change the external reality but helps you view things in a different and different light and less stressful way. For example, if someone is fired from the job, this is the reality. You can't change this reality. He has been fired from the job, but he may reframe his mind by saying that this uh, expulsion from the job may be the another opportunity to get a better job. So it's the reframing. Other is the ventilation. If you are going to share your problem with someone else, means problem is hard. You are going to reduce the pain of that problem by sharing and ventilation. Being assertive involves standing up for your personal rights and expressing your thoughts, feelings, and beliefs directly, honestly, and spontaneously in a way that doesn't violate the rights of others. मीन्स कि आपके किसी फ्रेंड ने आपको कहा कि यार ये मेरा काम कर दे, और एंड इफ़ यू आर ऑलरेडी ओवरबर्डन और आप कर्टेसी में उसके उस काम को भी ले लें और दूसरे फ्रेंड के भी काम को ले लें, तो ना आपसे वो काम होगा और आपकी अपनी साइकोलॉजिकल हेल्थ बड़ी ख़राब होगी। तो वहाँ पे आपको असर्टिव होने की ज़रूरत है, लेकिन ये भी नहीं है कि आप दूसरे बंदे को हर्ट करें या उसे बिल्कुल ही वो कहें कि जिससे आपकी फ्रेंडशिप भी ख़त्म हो जाए। You are going to express your thoughts, feelings and beliefs directly, honestly and spontaneously कि भाई मैं ये काम पहले ओवरबर्डन हूँ, मेरे साथ ये है, मैं कोशिश तो कर सकता हूँ लेकिन शायद ये चीज़ें ना हो और आपका काम खराब हो जाए, तो वो ज़्यादा बेहतर है कि आप पहले से बता दें rather than कि you are going to take that responsibility and you are not able to fulfill that assignment, वो फिर और ज़्यादा खराब हो जाएगा। Neutralization is more or less similar to the reframing. Other points are the time management. Make a list. What must be done, what should be done, and what would you like to do in the weeks or months. Must जो चीज़ें करनी है वो विद इन डेज में है, शुड वाली जो चीज़ें हैं वो विद इन वीक्स में है, और बाकी चीज़ें आप मंथ्स में भी कर सकते हैं। सो यू हैव टू मेक ए लिस्ट ऑफ टास्क के कौन सा काम पहले करना है, और बहुत सारे कामों का एक टाइम पे स्ट्रेस ना लें। लर्न टू ड्रॉप अनइम्पोर्टेंट एक्टिविटीज, से नो और डेलीगेट। वही यहाँ पे से नो और डेलीगेट असर्टिवनेस से रिलेटेड है। प्लान योर डे एंड सेट अचीवेबल गोल्स, कि वो चीज़ें आप करें जो आप अचीव भी कर सकें, छोटे छोटे टास्क बनाएं। नाउ वी कम टू द एंटी डिप्रेशन। In antidepressant there are the SSRIs and there is list of other drugs SNRIs, and I will go through with all this classification, but before that antidepressants are effective, non-addictive। एंटीडिप्रेसेंट के बारे में लोगों का जहन ये होता है कि ये भी एडिक्ट कर देती है, although these are not addictive and not known to lose their efficacy over the time, not known to cause new long-term side effects, and you are going to select an antidepressant by seeing into these factors. One top at the top is the safety of their drug. You have to consider the drug-drug interaction potentials, tolerability, efficacy, payment or cost effectiveness, simplicity of dosing or need for monitoring. These all factors are very much important related to the selection of antidepressant. So this is the classification of antidepressant. There are the tricyclic antidepressant, SSRIs, which are the specific serotonin reuptake inhibitors, which include the escitalopram, citalopram, fluoxetine, paroxetine, fluvoxamine, sertraline. And in tricyclics, you are having imipramine, amitriptyline, clomipramine, dothipine. The other group is the SNRI, serotonin norepinephrine reuptake inhibitors, which is the venlafaxine, and other category is the NASA, noradrenergic serotonin, specific serotonin agonist, which is the mirtazapine. It's going to have an impact on the 5-hydroxytryptamine receptors, noradrenaline, and antihistaminic receptors. And the other category is the NDRI. NDRI is the norepinephrine dopamine reuptake inhibitors. Means if someone is having psychomotor retardation in which there is the deficiency of norepinephrine and dopamine, so you are going to prescribe this NDRI. So there is the list of um, different antidepressant, but you have to choose antidepressant according to the height, build, age of the patient, and you have to consider the comorbid illnesses of that person as well. For example, if someone is having cardiac issue, you are not going to prescribe fluvoxamine or tricyclic antidepressant, because tricyclic antidepressant may cause cardiac arrhythmias. And if someone is in need of a sedating antidepressant, so you can prescribe tricyclic. And if you are dealing with a student who has to attend the school or college at daytime, so you are not going to prescribe any sedating antidepressant. Rather than you have to give alerting antidepressants such as fluoxetine. So there is the choice of antidepressant according to the height, build, age, and uh, you have to consider the routine of that person, work or occupation of that person, and the comorbid medical illnesses. This is the list or drug of choice in the special group of the patient. For example, if someone is having pregnancy, female having pregnancy, there is the list of the drug which are safe in the pregnancy. In lactation, there are certain drugs such as sertraline and paroxetine which are safe in the lactating period. हेपेटिक impairment में कौन सी सेफ है वो भी इसमें है. रीनल impairment में कौन सी दे सकते हैं. इवन epileptic patient who comes to you with the depressive disorder, which drug you are going to prescribe वो भी इस लिस्ट में है. ischemic heart disease का अगर कोई पेशेंट है या रिसेंट में उसे एमआई हुआ है तो अलॉन्ग विद डिप्रेसिव डिसऑर्डर, तो विच ड्रग यू आर गोइंग टू प्रिस्क्राइब. बच्चों में कौन सी सेफ है और जेनेटिक ग्रुप में कौन सी सेफ है वो भी इस चार्ट में है. And this slide is, I think, last slide, in which if someone is not going to get well with these all medications, at least you have given 2 or 3 trials of antidepressant and that person is not improving. On the other hand, if someone is having suicidal ideas and you can't wait for the medications to have a good effect, um, so the option is ECT, electroconvulsive therapy, in which you pass a minor quantity of current, I think about 2 to 400 joules, which is going to stimulate the neurotransmitters. This procedure is done twice a week mostly, and it causes the redistribution of the neurotransmitters within the brain, and it's having a rapid recovery as compared to the medications. But this treatment is not considered as a first line. The medication, psychotherapy, then medication, and after that you are going to consider ECT if someone is not improving or there is danger to life because of the suicidal ideas or poor intake. The other option is the vagal nerve stimulation, and new treatment strategy nowadays is the repetitive transcranial magnetic stimulation, which is going to stimulate the brain neurotransmitters, but this is costly procedure. And what is the duration of the treatment? If someone is having first episode of depression, you are going to treat that person at least for 6 to 9 months. Means that you have to continue medication for 6 to 9 months. And if someone is having second episode of depression, then 2 years. And if someone is having recurrent depression after every 6 months or years, then treatment may be 2 years or more. Other non-pharmacological approaches to treat with the depressions are the use of tyramine containing foods, जो कि फिर serotonin के बनाने में help करती हैं. These are the bananas, yogurt, chicken liver, and red beans. Education of the patient and his family about the prevention and harmful use of the psychoactive substances, sleep hygiene, exercise, problem solving techniques, participation in the social activities means engaging the person to positive activities, stress management, and time management. And this is the last slide in which you see the patient is one patient is saying